Hello, everyone, and welcome to this special update coming to you live from the studios of the Government Information Service National Television Network. I am Lisa Joseph, and this update is where we'll be announcing some of the stricter protocols as we experience this community spread of COVID-19. In studio with us, we have the Prime Minister of Saint Lucia, Honorable Alan Chastanet. The Chief Medical Officer is here, Dr. Sharon Belmar-George, as well as Deputy Police Commissioner Milton Desir. We do have in studio with us representatives of the media. We do have Choice Media Networks and HTS Television, and we also have joining us via Zoom the rest of the press corps. We will be taking questions from members of the media following the presentations by our head table. Also in the audience is the chairman of the command center, that is Honorable Dominic Fede, as well as the Chief Environmental Health Officer, Mr. Parker Ragnanan. We'll be hearing from the chairman of the command center as well. But for now, let me go to the head table and welcome the Chief Medical Officer, Dr. Sharon Belmar-George. She'll be giving us more detail as to the community spread, plus some analysis on where we are at with that. Dr. George?
Good afternoon. Thank you very much, Ms. Joseph. I will give a summary of our COVID-19, our confirmed COVID-19 cases to date in country. Can we go ahead with the presentation, the PowerPoint slide?
Yes, we are good for that.
Okay. The first slide indicates our dashboard. You'll notice that as of today, October 30th, we have a total of 76 confirmed cases in country. We presently have 47 active cases, and we've had an increase of 40 cases over the last 14 days. Of those cases, 18 represent imported cases. We've had 3 repatriated cases as well. The ages range from 3 years to 84 years, with 27 recoveries and 0 deaths to date. All of our active cases are stable and doing well at the respiratory hospital. We've also done a total of 10,686 tests as well. This gives an analysis of the distribution by age and sex of the cases. As I indicated, the ages range from 3 years to 84 years, and the majority of our cases have been female. The other part of the analysis gives an idea of the distribution by region, and also from the map you notice that most of our cases are on the northwestern zone and on the eastern zone, and over the last few days we've been noting cases in the south of the island going towards the western area as well. This gives an idea of how our cases have increased since the first case on the 13th of March. And if you notice in the last 3 epi weeks, the rate of increase has been at a much higher level as compared to earlier on in the outbreak. Okay, this is our community mapping for Saint Lucia of the cases that we have seen so far. I think I've explained a bit of that already. This is an analysis of the OECS and associated members to indicate per our cases per 100,000, how we compare in comparison to earlier on in the outbreak. Initially, we were at the lowest incidence in the region, and we are now at the 4th level compared to the rest of the OECS. Thank you.
Okay, thank you very much there, Madam CMO. We will now have Prime Minister Honorable Alan Chastanet, who will speak to us about what on the policy end of things, and also to announce what those measures are that we will be having to institute as we try to contain the spread of COVID-19 community-wise. Honorable Prime Minister.
Thank you. Given the current status of active cases and projections, the government of Saint Lucia is implementing enhanced protocols in order to curb the spread of COVID-19 to be effective today, October 30th, 2020. On the recommendations by the Command Center, the Chief Medical Officer, and consultative sessions with the National Emergency Management Advisory Committee, NEMAC, and various stakeholders, the Cabinet of Ministers has approved the following. Work from home where possible. All agencies and businesses should implement a blended service operations approach where possible for the employees. The approach should allow for the functioning of all services and operations utilizing online platforms and standard health protocol where feasible. This recommendation aims to reduce the physical numbers in the workplace and curb possible transmission. Reduced mass crowd events. Mass crowd events are reduced from 50 to 25 people per venue, per activity. No special provisions will be extended for ground, space, or structural provisions. Religious institutions. Religious institutions are to be guided by the square footage of their respective spaces. Each religious institution must be aware of how many people can access the building, but the maximum number of people of 100 for those institutions that are very large. Business operating hours. Cease all business operations and commercial activities by 9 p.m. Essentially, this will assert a minimal operations approach. Exemptions will be listed. This recommendation aims to discourage the physical spread of people during typical hours of high-risk business activity island-wide. Extended closure of school compounds. Public and private educational institutions should extend the closure of compounds and ensure continued learning via alternate and telecommunication mediums. This recommendation aligns with those aimed at reduced physical activity and mass gatherings. Grab and go, no consumption of alcohol on premises. Sale of alcohol is permissible. Grab and go businesses at bars only. All bars and restaurants to close by 9 p.m. This recommendation will assist in limiting high-risk social gatherings and curb the possibility of community spread. Sporting activity change. The hosting of any contact sports, high-risk sporting activities and events will be discouraged. Non-contact sports will be listed. This recommendation will assist in limiting high-risk social gatherings and curb the possibility of community spread. Limit movement advisory. Recommendation of voluntarily limiting movement between 9 p.m. and 5 a.m. Essentially, asking people to take personal responsibility for their movement and encourage staying at home between the hours of 9 p.m. to 5 a.m. This recommendation aims to discourage the physical spread of people during typical hours of high-risk social activity island-wide.
Thank you very much, the Prime Minister. And of course, we will get to go over these measures and what exactly they mean as we get deeper into the conversation. Let's now welcome to the podium the Chairman of the Command Center, the Minister for Tourism, Information Broadcasting, Culture and Creative Industries, Honorable Dominic Fede.
Thank you, Lisa. And I want to recognize the Prime Minister, Honorable Alan Chastanet, CMO, and also the Deputy Police Commissioner, Mr. Milton Desir. One of the issues that we have had to deal with during the pandemic is the whole question of false information being spread. I would like to use this medium to announce that the government is indeed engaging the private sector to come up with a very strong coalition to combat the spread of false information. We will be going on the assault with a very comprehensive and effective public awareness campaign to help to spread the right information through the right channels. We've also met with media owners in this regard to get their support and to get them to join this coalition which we're seeking to build. We want to ask you, the public, to as well, only listen to the official sources of information, as this has become absolutely critical. There really is too much for us to lose. As I look at the gains that we have made in our economic recovery, some 5,000 jobs in the hospitality sector are back. 80% of our hotel rooms have reopened. Some extra flights have come in. So Tuesday rather, we had Thomson Airline flying to Saint Lucia, the first long-haul destination in the world. Not Hawaii, not the Maldives, Saint Lucia. We will also have, for the first time, out of Manchester Airport, the flight from Thomson Airline, something we didn't have before COVID. So we see that as we continue to manage the public health side of our response well, that this is going to yield significant dividends to the tourism and the economic recovery. We will have some 80% of our hotels open by the end of this month. By January, all of our hotels should be reopened and as well generate the much needed jobs that are still on the breadlines. We see that our September has closed by 35% pre-COVID when compared to what it was last year. Our October is inching closer towards 40% in terms of tourist arrivals in terms of where it was last year. And so I want to take this opportunity to say to members of the public that what we're insisting upon today are not curfew measures, but are measures to solicit your cooperation, are measures to help to stem the flow of movement of individuals from communities to another. We're only encouraging at this point movements of individuals that are necessary and essential so that we can all do our part. We all have to do more. We all have to make sacrifices. We all have to look out for each other at this time to ensure that our grandmothers, our mothers who are diabetic, who are asthmatic, who are suffering from other respiratory diseases, that they are protected from our very actions. And so all of us have the very serious obligation to ensure that we take some measure of self-sacrifice. The way we conduct ourselves at beach parties, at funerals, and at various gatherings that are very important to us, we now need to take that extra step to ensure that we support the health department, the command center. I want to thank the business community for their very strict adherence to the protocols, for helping us to enforce the protocols. By and large, we see that in our business community and throughout Saint Lucia, there have been significant compliance to the protocols, but we still all have to do more. We still all have to ensure that we stem the current tide of COVID-19. Thank you, Lisa.
Thank you very much, Minister. And let's just go quickly to the Deputy Police Commissioner, Milton Desir. Just give us a little overview on the preparedness of the police force as it continues with enforcement of the protocols.
Okay, good afternoon all. Good afternoon to the hard-working police officers out there. I know that it has been a challenging task to you all. Also, let me send out my greetings to the Vieux-Fort police station in particular, where a few members, 2 members have been tested positive. We know that the others are concerned. Let me assure you, if the protocols are maintained, that you would be safer. I know that we are working with Ministry of Health as much as possible to ensure that this is done and persons tested. Now, from inception, we have been faced with challenges in terms of our enforcement efforts, reference to the COVID-19. We have challenges such as persons, the main one, persons not complying with the protocols. I must at that point indicate that we have seen a lot of individuals and establishments, they comply with the protocols. That is very good, and I commend them for that. But for the remainder, we're asking that you do likewise. That is all the police is asking of you, to be responsible. Police yourselves, because we at the police force, we have other things running parallel with the COVID-19. We have the crime that persons are committing, and we need to ensure that we are on top of it. We need to ensure that persons' lives, you are safe, your property is safe, and that we enjoy our Saint Lucia. So we're asking that you observe the protocols set out by the Ministry of Health, so that we now would get the opportunity to do more in terms of crime fighting. We have a situation whereby persons are entering the island illegally, and that is usually coming from, all indications, coming from the North Martinique, Guadeloupe area, and coming into the island. We must, at that point, indicate that it is, in as much as it is illegal, it is not safe for Saint Lucia, and in our efforts to combat the disease. Persons, we would rather persons come in legally, because by the legal means, you have the protocol set out. As soon as you land, there are the protocols. We have the taxis, we have the hotels, and so on, whether you were sent to home quarantine or at the various quarantine sites. There are protocols that need to be observed. But when you come through the back doors, as it is said, there's no guarantee that you would maintain. In fact, there's no protocol being observed, because you try to elude everybody. You elude health, you elude the police. So I'm urging members of the public now to give us that information, and I must thank those who are calling. We are receiving the calls, we are getting the information. Sometimes it is too late, because we cannot act. Then persons have mingled with individuals. So in as much as we appreciate it, but we are saying if we could get it a little earlier, then that would do. As I've said, we are stretched with resources. Our response vessels, we are doing all we can with whatever that we have. We know that we have the entire island to cover, and in as much as we have 5 legal ports of entry, we have, I would say, so many illegal ports of entry. So we are urging persons that they should desist from that practice. Also, I would like the members of the public to note that we, the police, it's not about penalizing anybody for not observing the protocols. We realize that, and this is why sometime 2 weeks back we started issuing masks for persons who did not have a mask, or probably they had forgotten theirs. We saw the clips of the police distributing masks. But I believe the time has come where persons need to take personal responsibility for it, and for non-compliant, we have sanctions, and the police would be out there to ensure that all protocols are maintained, and to do what it takes to ensure that you maintain the various protocols.
Thank you very much for that, Deputy Commissioner. Okay, let's get into, before we go to our in-studio journalists, just a question to the panel at first. Let's deal with what we consider the voluntary limiting of movement, because we're not calling it a curfew, we've not instituted a curfew. So, Madam CMO, what is the thinking behind having it voluntary?
We are at a point where we really need to take some level of personal responsibility for our health and safety. Given the rate of increase of transmission that we've seen over the last 3 weeks for COVID-19, it is almost impossible for us to have the police officers and our environmental health officers everywhere. We can't be everywhere asking persons to keep a mask on or to, within the various services, to adhere to the protocols. But each and every one of us need to know that there is a risk. I showed the map earlier to show the distribution of cases around the island. As we've been doing contact tracing, we see more and more violations, increasing the risk of transmission. We've also noted that the number of positive cases coming out from each index case has increased with this second wave, and this is because of the non-compliance or the non-adherence to our protocols. So we are asking the public to take a level of personal responsibility for themselves and for their families, that you go out only when it is necessary. You avoid crowded areas, and if you have to go out, you ensure you have your mask, you avoid crowded areas, and you take all of the necessary infection control measures, such as keeping your hands clean and all of that. There are certain places we need to go to, like the supermarkets, like the bank. You go there with caution, and as much as possible, you don't need to go with your entire family to those areas. So this is a respiratory illness which, in crowded areas where a lot of persons are gathered, it increases the possibility of transmission. So we're asking as much as possible to limit movement within these 30 days to break the chain of transmission at this point, so we can reduce the numbers that we are presently seeing happening here in Saint Lucia.
Prime Minister, on the government end, so we have it from 9 p.m. to 5 a.m. So just give us the government's thinking about this as well, and why not call it a curfew?
So first of all, we would remember that we used to have this state of emergency. And the difficulty, well, I shouldn't say the difficulty. State of emergency was very necessary in the initial stages of the COVID outbreak. And what the state of emergency allowed us to do was to introduce a series of protocols. So these protocols came out in the form of what we call SIs, statutory instruments. And these statutory instruments came about or were designed through collaboration, whether it be with the Hotels Association, individual businesses, institutions, the public service, all the persons that we make up our country. And it outlined how we're supposed to behave and the discipline that was required. We decided to, end of September or beginning of September, end of August, to move away from the state of emergency. We recognized very clearly that COVID was going to be with us for the next 2 years. And so we implemented a new act called the COVID Act. And that act gives us the ability to maneuver very quickly, like we are right now, in implementing necessary protocols. And it gives the legal authority to be able to do so. It's important for us to appreciate what is it we're attempting to do here. We always knew that we were vulnerable to COVID. And we were very lucky, and in part, we were very successful with the things that we did that caused us to only have 29 cases. And luckily for us, and for Saint Lucia, no one had died. The protocols that we were attempting to make sure that people adhered to was our defense. That was our army. Because we always knew that the possibility of COVID coming in illegally into the country would be at risk. We also knew there was a possibility of it coming in legally because we had reopened our doors. But we saw that the protocols that we had put in place through the legal channel had produced zero risk to the country. But when it came in illegally, by its nature of being illegal, people were interacting, and we now saw the spread. If in fact that we had been adhering to all these protocols, when we went to bars, when we went to different places, had our face mask on, if we had continued to practice social distancing, if in fact we kept on sanitizing our hands, that even if the COVID had come in through the back door, the ability for it to spread would have been minimized significantly because of those protocols. Sadly, human nature is what human nature is. And many people were going around in Saint Lucia indicating that we didn't have COVID, and the Minister of Tourism reminded us about the fake news. Persons who were continuing to try to say that there is disinformation being provided by the state, that COVID doesn't exist, and that wearing a face mask doesn't work. And that kind of information certainly contributed to persons not adhering sufficiently to the protocols. So what we are doing here is strengthening the protocols and the ability of the officers to enforce these protocols on both a voluntary basis, meaning that we're recommending that persons go home after 9 o'clock at night and try to stay home between the hours of 9 and 5. Does that mean that you have to? No. If in fact you're working late, you're at a factory, there's things you have to do, please proceed to do them. But we're asking, if in fact you don't have to be out, don't go out. And we're trying to minimize the activities that causes groups of people to be together. It's the groups of people coming together that create the environment for the COVID to be able to spread and to make contact tracing much more difficult. And that's why you're seeing it being spread around the island. So enforcement is critical. The border control that the Commissioner has spoken about, and that we will be announcing some changes with the Ministry of Agriculture with regards to the fishing boats. Protocols for our buses. We are seeing that when people are leaving the station, the bus stop, that they're adhering, and the moment that they move, they're taking the face mask off. So we will be beefing up the manpower at the police, where we can have now undercover police officers in plain clothes going on those buses. And if in fact persons are not adhering, then we are going to fine them, and in some cases it may lead to the suspension of a route ban for some of the drivers. We're going to be adding private security. We're going to be beefing up the Ministry of Health so that there can be more regular inspections of the businesses to make sure that they are adhering to the things. We talked about cooperation, Lisa. We've spoken to the biggest producers of alcohol on the island to do an outreach program with the bar owners to really make sure that when we reopen and we reduce these hours of operations back to its normalcy again, that they understand that they need to continue to adhere to the protocols. This is with us until there is a vaccine or a cure. And we must be on our P's and Q's. And what's at risk is the health of our nation, the health of ourselves, the health of our family members, the health of persons with underlying conditions, and also the economic health of our country. We need to coexist with both of them. And so having our factories open, allowing our farmers to continue to produce, allowing the construction sites to continue to be operational, to allow the banks and the grocery stores to remain open, to allow the hotels to continue to operate. These are all critical things in regaining the economic strength of our country. And what this requires, Alyssa, is teamwork. Teamwork from individuals, teamwork from companies, and teamwork from our frontliners. And let us stop exposing our frontliners. So we believe that the public of Saint Lucia have shown over the Jeune Creole weekend that they understand the magnitude of the problem that we have, and that they have significantly listened and adhered to the protocols that were being recommended based on the consultation with the command center and the CMO's office and from the NEMAC meeting. We're putting in these enhanced protocols and asking persons to, on a voluntary basis, to adhere to them. But there certainly will be the underlining authority of the COVID Act to make sure that people adhere to it.
Okay, thank you very much, Prime Minister. We now go across to our in-studio media representatives, and we'll say hello to Ms. Nelsia Shalmine from Choice Television.
Hi, good afternoon. We seem to be relying a lot on public responsibility and public cooperation with our new protocols. But Prime Minister, you yourself have cited that there was a break in following those protocols earlier this year. So why not use the powers conferred to the government or to the command center under the COVID Act to put more rigid restrictions in place, perhaps actually having a curfew from 9 to 5?
So we have actually used the COVID Act to enhance things. So we have basically implied that there's a curfew. We have restricted business hours, that everybody needs to be closed by 9 a.m. Now there will be 9 p.m. Sorry, and there will be a list of companies and industries that are exempt from that. But we believe and we have confidence in the public of Saint Lucia. We've seen through Jean Creole and other activities that they're taking this thing seriously. And what this is to do is to provide guidelines to the general public. We think it's impractical to put a curfew. We knew how difficult it was before. Because we were dealing with a virus that we didn't understand, we felt we had no choice but to put the curfew in before. The curfew means we have to issue out passes. You have people going to hospitals. It's going to be really incredibly disruptive and very difficult to address. And I think that the Madam CMO, she's probably even better placed than I am, to say that if people simply adhere 100% to wearing your face mask, social distancing, and sanitization, that in itself would require nothing else. So what we're introducing today are to be subtle reminders to everyone as to how important it is to do so. So by diminishing the opportunities for people to be socializing after the hours of 9 p.m. and 5 a.m. is not to say that you cannot be moving around. You can, but please stay away from the social. So somebody said today, well, the COVID doesn't start at the bars. The bars facilitates it. So people coming together from other parts of the island, drinking, letting their guard down, not wearing their face masks, not practicing social distancing, enhances the opportunity for the virus to spread. So what we're attempting to do here is we know that when you're in your business offices, people are adhering to the rules. We're seeing stories of persons going to work, wearing their face masks, doing all the right things, and then they leave their office space and it's like if they think that they're in a different place. And there's also a stigma that's being associated to wearing a face mask and to practicing the protocols. We must learn to love wearing our face masks. We must learn to love the social distancing that we're putting in place. We must learn to love washing our hands, because in doing those things, we're protecting ourselves and we're protecting our family members, and we're allowing ourselves to continue to coexist with COVID.
Thank you very much, Prime Minister. Let's say hello to Solange Alfred of HDS Television.
Good afternoon. My question is, how long will these enhanced protocols last?
The protocol? The duration?
For a period of 30 days.
So will there be sanctions against persons breaching the 9 p.m. to 5 a.m. voluntary curfew? And if so, what will it be?
There won't, I think that's for Mr. Daisy.
As much as possible, as I said earlier, we would allow persons to police themselves. However, there may be instances where the police have to act, and we will act. We would be out there. We would be looking at a situation. Every situation would differ. You may have someone who is working late at night. These persons would be allowed to traverse the area and so on. So it is not a matter of having fixed sanctions, but more or less police using their discretion whilst on the road and doing it. And as I said, we rely a lot on individual responsibility. Yes.
Okay, in high traffic areas like supermarkets and banks, for instance, will there be any monitoring done by health and law officials to ensure compliance?
Just to reinforce what the Commissioner said to you on the previous question, there will be enforcement for companies who continue to operate after 9 p.m. But the movement of people is allowed. It's really the coalition or persons clustering together in sizes more than 25 that's what the authority will prevent from happening. We are recruiting persons from within the civil service to go to the environmental department, environmental and safety department of the Ministry of Health, to increase the number of persons that can do inspections. So they will be going to the grocery stores, going to the banks, going to the restaurants, going to all the different institutions to make sure that what the certificate of approval that they agreed to do, that they're actually doing it. So it's through enforcement, but in adhering, full adherence to the existing protocols, that we're going to win this battle.
Okay, Prime Minister, this will in no doubt impact the economic standing of the island even more, since we're shutting down earlier. Will there be any reassessment of the targeted approach highlighted earlier this week in regards to income support?
Absolutely. So for instance, we know that there's going to be an impact on the bars in particular. The minister has already agreed that we will immediately meet with that association. I've spoken to some of the alcohol producers on the country to get them involved. This is for a 30-day period. And again, I want to say that certainly I would be the happiest person if the Madam CMO came to me after 2 weeks and we saw that we're not seeing any additional cases and the threat has come down significantly, and that we can then reverse some of these positions very quickly. So it's how quickly we can adhere. Our future is in our hands. We control our own destiny. And so I'm really seeking the assistance of everyone to adhere. The quicker that we do this, there is no other cure. This is simply reduce the number of person-to-person contact, and the virus will dissipate significantly to a very controllable number. But certainly when you get 41 cases?
40 cases in the last 40
cases in the last 2 weeks, we've not reached a crisis, but if we allow this thing to continue and we don't curtail it, it can be even more threatening, not only to the health of Saint Lucians, but to the health of the economic health of our country as well. So let's work together and solve this problem as quickly as possible, and so we minimize the economic fallout on all different sectors of our society.
Okay. Before you have that follow-up, Nelsia, let's just hear from the Minister, Dominic Fading.
I just want to compliment what the Prime Minister has said. On the question of the economic fallout, I want to make it absolutely clear that we are very cognizant and appreciative. We've had several meetings with the restaurant sector and the bar sector, and we know that they're bleeding. For that purpose, the Parliament has approved for the Minister of Finance, the Prime Minister in this case, to borrow as much as $22 million, which go to small businesses within the tourism sector to help their recovery. So there is, in addition to an earlier income support we've done through the NIC at the workers level, now this second phase is going to the business level. And this should go to market. I think the Prime Minister would be more intimate with the timeline, but I just want to make that point as well to adequately answer your question.
Thank you very much. Yes, Nelsia, you may proceed.
Is this in any way, Madam CMO, I think you might be more poised to answer. I know that you just said we've recorded 40 cases in a 14-day period. We need 50 cases in a 14-day period to revert to a previous phase. Is this in any way a beginning of a step back to phase 4?
Yes, it is, because in the analysis, we note the increase in cases within a short period of time. Also, the rate of increase is also of concern to us. So based on our assessment, we looked at the higher risk activities and services for transmission, and these are the services that we are pulling back on first. For example, your bars, your mass crowd events. So we through our assessment, we looked at the services that lead to a greater level of transmission, and we're reducing those first.
I also want to ask about learning institutions. A lot of teachers and students complained earlier this year considering the abrupt shift in modality, and we seem to have returned to that now only a month and a half after schools reopened. Is there anything that the government is putting in place to ensure a smoother transition for a second time this year?
Globally, education has been a problem. Everybody is struggling with this because this is such a new normal for all of us. We have ordered 4,000 more e-books. But the reality is that we're seeing over time that online learning is not a replacement to our normal education system. The socialization of kids, the ability of kids to remain focused 8 hours on a screen. As much as our kids love being online playing games, being at school is very, very different. And certainly even the stress that it's putting on parents. Some parents are having to stay home and are having to become almost educators themselves. So this is certainly not a situation we would like to see continue forever, but this is what our reality is. And I'm certain that educators around the world, and no differently than Saint Lucia, are going to have to sit down and figure out how we're going to make up for the lost time of this last year, because really it's been very disruptive. Let's not try to candy coat it. It has been very disruptive. And not many places in the world have found a solution to that problem. Sadly, we're seeing France as an example closing down. I mean, I spoke to some friends this morning. 3 people in their family got infected because the kids came back home after being infected themselves. And so we know that with kids, it's much more difficult to see the symptoms because they have a much stronger resilience. But I'm not going to say that there are more spreaders than other people, but they spread. And because it's our kids, they come home and we're going to hug them and we're going to kiss them and we're going to be in close contact with them. So that relationship makes everybody extremely vulnerable. So I want to say that the government is absolutely cognizant and of the situation. We're working constantly with the teachers and also with regional education institutions, international education institutions, and trying to figure out a solution. I'm really hoping, honestly, that by next summer, and I know that seems like a long time to wait, but that's the reality. I mean, I'm speaking to other parents who have kids abroad. It's no different. Schools are trying bubbles. Schools have been trying, every other day? And reducing the number of persons interacting. But the reality is when you have a community spread, it affects everyone. And it has been extremely disruptive. And I just beg the indulgence and the patience of parents to know that we're doing everything that we possibly can. And at this point, they need to make sure that they're staying in constant communication with their children, allowing them to dialogue, allowing them to express their own frustration, and to do the best we can to find alternative things that we can do that are falling in within the protocol. But it's a very difficult time, and it's only in time that we, I think, as a society will know what the fallout of this really horrible situation has been.
Let's talk a little bit about the work from home. What is the level of buy-in that we have from the private sector where that is concerned? Because there are a number of people with school now out, it means that parents, they are supposed to be at work, but especially when they have very young infants. So what is the buy-in from the private sector on this, the level of commitment that has been given?
The buy-in has been really fantastic, and we've seen it in different businesses. The call centers we've had have had great success in training their persons at the offices, but sending them home to work from home. I think that we're seeing many businesses that are realizing that their productivity level actually went up. And so the cost savings of having somebody in an office space is very different. And again, this is going to be one of these game changers moving forward. We just heard that Microsoft has indicated that all the persons who are currently working from home will continue to work from home forever. We're seeing New York City, retail space, office space, residential space, collapsing because persons are now not wanting to live in big cities. And all of a sudden, businesses are realizing that we don't have to have all this office space. So I think that the trend is already continuing. All we're doing in this particular protocol is over the next 30 days, and this 30 days is asking that if in fact persons can remain at home, don't have to come in on the bus transportation system, don't have to unnecessarily expose themselves, that the company should do everything to minimize that level of activity at this point.
Thank you very much, Prime Minister. Let's go across to our Zoom platform and say good day to Joshua Santemi from The Star.
Hi, good afternoon. Mr. Prime Minister, you mentioned a while ago that the spreading of fake news has contributed to persons not adhering to protocols. The leader of the opposition also recently condemned the spreading of fake news. Do you propose to pass any laws relating to this issue? For example, let's say like similarity to 361?
So history has shown us that 361 failed. And certainly my government is not going to attempt to revive anything that has failed. But we have to find a solution to this problem. Because it's irresponsible. I think I heard somebody call in on a show and said, this is no different than having a crowded movie theater and somebody yelling falsely fire. And persons end up trampling to get out and people are hurt. This is no different. Anybody who is trying to go against what is information that's out there and encourage people to adopt a behavior that's contrary to the benefit of the nation, it's harmful. But this is something that we have to do collectively. I think that civil society, businesses, everyone should speak out loud and condemn this. But we also must recognize that when we get something, when we've said repeatedly on a health matter that does not come from the CMO's office or doesn't come from official channel, you passing it on to somebody else, you're participating in the crime. And this is the level of maturity that we need holistically. And I think the minister made reference to it, that we want to cause more people to stand up and condemn this kind of behavior. And there are some persons who are repeatedly doing it. And there are advertisers who advertise on their shows. So if we're going to take this thing really seriously and we all agree that it's wrong, and we also agree that it's dangerous for the state to implement laws that in any way prohibit people from speaking, and we know that, then I'm asking that we then do the right thing. You can show your disfavor to persons who continuously are peddling false information. And it's clearly questionable as to what the intent is. If somebody makes a mistake, it's okay. And they clarify it and they stand up and they're prepared to be corrected and do the responsible thing, it's great. But when people are even pointed out that the information that they are peddling is fake and they continue to do it, then we all need to stand up collectively together, because preserving our right of speech is critical. And I don't want to be part of any society that in any way limits democracy. But at the same time, those persons who benefit from that privilege must also hold themselves accountable, and we must hold them accountable to being responsible. They cannot deliberately attempt to send out fake information.
Thank you, Prime Minister. Let's just hear briefly from the Tourism Minister on this point.
So I think that this is going to require more than policy for us to stem this rather chronic cancer which continues to afflict our society. I think that, Joshua, your profession, journalism, will also have to play a role in ensuring that your industry is not used to give oxygen to fake news. I think journalism has been and will always be a profession that is guided by research, and one that is guided by fact-checking, one that is guided by truth, and one that seeks the truth, and one that really will ensure that it does justice to its viewers, its readers, and its listeners, to ensure that they are better informed and they can make better judgments about various issues, whether it's the economy, whether it's COVID-19, whether it's culture or sports, so that we all will become a better society. And so I believe that one of the pillars upon which a strong democracy will hinge on is the media.
Thank you for that, Minister. Let me just go across to Deputy Commissioner. So we spoke about the not imposing a curfew. However, it is a sort of voluntary limitation of movement by citizens. And you did say that police officers will be using their discretion. That is fairly broad to say. Can we perhaps narrow it down a bit? Will citizens be perhaps stopped and asked for reasons why they may be out? How will the police engage the citizens once this 9 p.m. comes into effect?
Yes, most definitely. If we are out there, we would be stopping persons. Find out your business. If it's after 9 p.m., persons may tell you that they are leaving work or they are going to work, because there would be some places that work would be going around for 24 hours. They are responding to an emergency, Lucilec, telephone company. So these persons, but we need to engage persons. It's not a matter of just seeing somebody after 9 and said that, hey, you were arrested for being out for after 9. But if persons are congregating, for example, in an area after 9, they have nothing doing but to congregate after 9, then we would have to use the powers that be here that we have to prevent them.
Thank you. Let's go back to the Zoom platform. Joshua, you have a follow-up question.
Well, it's an unrelated question about the mass crowd events. Prime Minister, you mentioned no special provisions will be extended for ground space or structural provisions, but for the religious institutions, they are guided by the square footage. Why the difference in that?
I'm going to allow the CMO to follow up, but I mean, in a nutshell, how persons are behaving in a church and how people behave at an activity in which they're consuming alcohol and excessive socialization is very, very different. And I think the Madam CMO will concur that the churches and the religious institutions have really done an amazing job and are to be commended on the protocols that they've instituted. They've understood it. It may not be the same thing during a funeral, and that's something that I know that we're looking at, but certainly during the point of prayer. And I think that you would also recognize, Joshua, that we know that a significant part of succeeding is prayer. And so we don't want in any way to limit persons from going to church, but there is a health requirement to have some limitations. And I have to say that the churches and the religious institutions have really done an amazing job, but I don't know, Madam CMO, if you want to enhance upon that.
I think, PM, you covered it quite well. The church, we've noted through our assessment of the church services that they keep during the Mass. However, our concern is the funeral services and what happens at the cemetery. So we intend on working with the churches to ensure stricter enforcement of protocols at that level.
I think that Madam Simo had put it really well. Persons who go to a church tend to be from that community. Persons who go to a funeral tend to be from multiple of communities.
Yes.
And so there's a science to this protocol. All we're trying to do is to minimize the interaction of persons from around the island and to minimize the intense activities. So it's not about people not being able to drive around the island after 9 o'clock. It really is to ensure that the activities that would cause them to socialize and moving around, that we bring those activities to a minimum level during the next 30 days.
Any other questions? Yes, Solange?
The next 30 days will be extremely important for the island if there isn't compliance and the numbers do continue to rise. What is the island's healthcare system capacity at handling an influx of cases? And CMO, can you give us a number as to where it becomes a situation where even more drastic measures may need to be implemented?
Okay, at this phase, we have a number of indicators for the public healthcare system that we've put in place to manage waves like this. One of it is the bed capacity at the respiratory hospital, the setup of the 5 respiratory clinics, our sustainable testing capacity in country, the capacity for contact tracing of persons, also our capacity for quarantine and for isolation, just to name a few. So at this point, our healthcare system is a lot better able to manage an increase in cases as we're managing now. The other question was about...
In regards to what number do we get to where we would have to implement even more drastic?
Okay, our target was we looked at 50 community cases within a 14-day period. And with the true definition of community transmission, it would be cases across the island without a necessary link. The cases that we have seen now, we are really in clusters of cases because we have been able to establish a link between our cases for most of the cases thus far. So, and the other issue is the number of complicated cases that we've seen. So far, we've only had one severe case that needed ICU care. The rest of our cases have been mild to moderate. So we were able to manage them without an extensive human resource needed. The second phase that we would go in is our present policy allows us to keep all positive cases within our respiratory hospital. If, however, we surpass that capacity, in our second phase, our mild and asymptomatic patients would be allowed to do so at home. And you could imagine the risk involved in that, but it would allow us the space within our respiratory hospital to manage more moderate and severe cases if needed. But we are not at that phase as yet. We are still able to provide the security of knowing that we keep persons within our respiratory hospital until they get 2 negative tests to allow for their safe return into the communities.
Madam Chairman, just to follow up on that, we haven't heard you say in a while that the patients are doing well.
Yes.
So can you give us, if you can,
yes,
an idea as to how well they're doing medically?
Yeah, at present, we have 47 active cases, and if you listen to yesterday's report, we had 49. So 2 of our cases have recovered today. I've not been able to give an update as yet, but we've had 2 of our earlier cases have recovered. So we have 47 cases in care, and they're all mild and moderate cases. We don't have anyone that we're concerned about in terms of complicating. So if everything goes well, we expect a full recovery for the patients that we have in care presently.
Okay, wonderful. Any other follow-up questions from the journalists in studio? Yes, Nasia.
To go back to the issue of schools, I don't know how well versed the panel will be to answer this, but we saw a lot of issues with CSEC and CAPE exams this year relating heavily to the disruption in schools earlier. Is our government putting anything in place or hosting any talks with CXC's headquarters in Barbados to ensure that this does not happen again?
So I know that there has been, but I would certainly think that that's an important enough question, and I would want you to get a full answer from it. So I'm going to ask Mrs. McDonald if she could make sure that we get a written statement to you, or to set up an interview for you right away, either with the Chief Education Officer, or the PS of Education, or even the Minister herself. But I know that there has been work been done on it. To the detail of that, I would rather leave it to them to answer.
Okay. Let's welcome to the podium Primus Hutchinson from the GIS. Okoyol.
Thank you, Lisa. Of course, we need to add a little Creole, but this is the record of the Commissioner of Police. But before I do, I just wanted to tell PM that 2 months ago, so at the ITEL BPO opening, that you jokingly suggested to me that perhaps we need to do something in Korea one of these good days. So when all the pressure is off your back, I'm sure we can work something out. Anyway, Monsieur Commissioner, ça nous voulons dire expliquer ces diverses règles qui gouvernement jamais mis en place pour adresser situation corona pays. À présent, nous savons que toutes les affaires pour faire l'hiver, c'est que business, cabaret, c'est ça là. Qui arrangement j'ai mis en place pour faciliter ces polices là pour adresser ça. Nous apprenons que la police pas une uniforme, tout ce ça là pour garder particulièrement situation côté monde quand tu es quand tu es backdoor pays. Ça c'est chay trois souvent avec chay pressure là ces police là. Qui veut dire qu'on balancer situation ça là. Merci.
Oui, comme je déjà dit, ça c'est un bagage qui a police a problème, spécialement c'est les gens qui sont venus ça nous a couillé back door, ça c'est pas qu'à entrer c'est legal, c'est porte là qui est autorisé, so you can juste aller pour me faire simple. Tout le monde savent ça, nous a dit, il a prendre un canot, un bateau, et puis il a aller, si c'est Martinique, c'est Vessan, et bien Guadeloupe, côté qui peut, et puis il a viré, ça, personne savent qu'il a viré à l'air, qui police pas savent, customs pas savent, et bien immigration. So, il a fait contrebande, il a aller, il a viré vide. So, nous avons des marches pour nous adresser ça. Ça nous a fait, c'est police marin, marine police. Juste bon matin, maintenant discussion et puis Premier ministre, et puis il a assuré moi qui nous tenu d'autres titres difficiles, spécialement, et puis c'est bout là, mais ça a arrangé. Nous hier nous n'ayons qui était très satisfait manière moi il a répondre en les de loi. Nous va faire combien bagaille nous a ni moun en ces côté c'est là ou de la côté yoka venir, so nous a fait un chai pour try empêcher ça, mais il y en a ces bagaille là nous aussi garder, c'est pour moun venir through manière legal means, so ou payer l'air, so c'est un bagage qui nous pas mettre ça en place, mais nous ka garder si nous ça nianti manière, so c'est moun nan kay venir ensemble, nous kay arranger transport bayo pour yo venir, nous kay signer ça parce que l'on venir through c'est manière ça là qui nous voulons venir là toute bagaille qui est en place, nous kay ni ministre santé kay là yo kay fait tout ça yo payer l'année, c'est taxi driver qui est autorisé, ils savent quelle manière pour yo deal et puis ces bagailles ça là, so nous kay try pour limiter ces manières ça bagaille là Covid qui spread. Et là dit l'autre bagaille encore nous kay fait c'est bus là qui a transporté passagers Loire à Bouezan ou Pénion yon qui a porté 16 passagers, 12 passagers, mais Loire c'est ou kay ni 10 ou pas supposé ni plus qui 10 passagers à bord bus basso. So nous kay fait ça nous paye pour assurer ou observer loi ça là et puis nous commander ces membres publics qui a navigué en ces voitures ça là pour ensure si ou c'est numéro 10 ou ni pour di driver ou ni 10 ou pas masser pièce l'autre monde et puis tout le monde supposé mettre tête yo ensemble et puis pour empêcher driver faire ça et puis bus là ou kachaya c'est un public ça nous a un public service vehicle ou paye pour l'argent et puis gain mais là il a fait service pour public là il en bas contrôler contrôle gouvernement so où ça joindre un ticket et bien on ça un charge pour si vous menez plus passer 10 passagers aussi masque là moun ni pour assurer qui c'est les autres moun qui à bord machine à mettre masque il pas supposé point yon police pour venir cadre di moun mettre masque tout le monde savent nous ni en temps nous y a on est pour mettre un masque ou ni pour laver la main ou ni pour sanitiser ou ni pour chain distance et puis tout le monde a dit about yo ka quitter vieux fort avec 10 passagers yo ça point 16 non ça Ministry Health a dit si pour 10 passagers c'est yon en chaque bout de ce site là il a fait 10 passagers so nous pas vle moun en mi-temps so il a limité spread of ces virus ça là ça nous aussi discuter c'est nous pas vle plus qui 25 moun assemblés en côté pas koy so pour raison ça là nous pas kay bail pièce permis pour ni danser so nous pas ça ni ça parce il est bien difficile pour des moun danser et puis ou ka chen protocole là moi pas savent que manière il est fait mais ou supposé ni masque ou supposé ni 6 pieds à distance so depuis ou ka et puis nous savons danser ka aller ou ka boire ou peut commencer à danser par corps mais depuis on est des gog ou ka vle tchebe un monde pour danser so toutes ces bagages ça là nous ka try pour do bout aussi c'est temps pour fermer shop magasin yo jamais été pour retail so après retail là pas ni ou pas ouvert pour vendre so nous quoi lait ça c'est un bon lait parce que à retail en chay bagay déjà fait so nous mettez retail pour limo moun qui a dans un établissement comme nous t'ai dit c'est 25 mais ça pas applicable pour c'est l'église là nous savons c'est l'église là goan et puis limo a kaweste a yon 100 so yon 100 moun ça en tout et bien si pas ça ou si l'église là tout petit qui passe à point sans leur faire ces distances là ou kay pour mesurer pas yon moun pas 30 pieds carrés so ou kay ça nous ka dire l'anglais one person per 30 square foot so ça nous ka dire qui kay JD qui quantité moun qui en l'église là mais 25 comme on dit 25 là pas applicable pour l'église. Oui.
Merci pour ça, Deputy Commissioner. You have a follow-up question before I throw to the panel, and a question to Mr. Parker Ragnan and a little later on.
Just to clarify, CMO, what is VH's capacity to handle the COVID-19 cases, like in regards to a number?
VH's capacity is an 84-bed respiratory hospital.
And I have one more question. Is it correct that persons entering a legal port of entry showing a negative COVID-19 result and showing no symptoms are not required to test locally?
If you've come in with a negative result and it's accepted at the port, we would not repeat your tests on arrival once it's within the 7th day as stipulated.
Yeah. Because that was a question that I had for Mr. Parker Ragnanan. But before we get to that, we will take the question from Nelsia Shawn.
Two final questions from me. One, the restaurants, do they function as the bars do with grab and go? Yeah? And to CMO, I know we've been notified of
Sorry,
touring.
people are allowed to go to a restaurant up until 9 o'clock.
So can they dine in?
They can dine in, but there's a limited of 25 people at any one time. And then after that, it's grab and go. But it's the bars that are grab and go from the beginning.
Okay. So after 9, the restaurants operate as grab and go?
Delivery, no?
No, they close at
They
9.
just close.
To 9.
Okay. And Madam CMO, you've spoken, and I think a lot of people are happy to hear the news, 2 recoveries today. Are we expecting any announcement of new cases today?
I have not received results of new cases. I will check with the lab after this, but I have not received reports of new cases.
Okay, let's just ask a question there, Mr. Parker Ragnanan, the Chief Environmental Health Officer. We've been hearing the news that the hotels are beginning to get back to as full of capacity as possible. From the port health standpoint, in terms of how you are beginning to ramp up what you've been doing over the last 6 months to accommodate the influx at this time.
Okay, good afternoon, and thanks for that question, Lisa. As far as the ports are concerned, we have made significant strides in terms of the measures to process persons coming into the island. We've seen a significant reduction in the time phase it has taken to clear passengers. It, at the beginning, took us between 2.5 minutes to 3 minutes to clear one passenger. Currently, that is being done in about 45 seconds. So there is a significant increase of intake in terms of our capacity to be able to do clearance of passengers. And we've been seeing there are certain days, especially on a Thursday and Saturday, that there are increased number of flights. And even then, they have been able to be handled quite well. We continue to administer for additional resources as we see more flights are coming in. But at this juncture, the team on the ports are doing a tremendous job, and we need to continue to support them and commend them in terms of the actions that have been taken. We also want to appeal to nationals, because the bigger part of the problem that we experience at the ports deals with nationals that are coming in. And that is not to single out our nationals, but the point is, persons believe that they have a sense of right coming into Saint Lucia, I'm coming to my country. And therefore, the difficulty is trying to explain to them the protocols, the issue of why they need to go to a facility quarantine and not home quarantine when they are not able to meet or approve for home quarantine. And sometimes you get that kind of resistance, even to the point where if they need to do a PCR test and they need to pay for it, sometimes there is resistance. We get that kind of challenge at the ports. But we need to continue to work with all the sectors and see the improvement. And clearly, we are thankful so far for the strides we've made as far as the ports are concerned.
Thank you very much for that, the Chief Environmental Health Officer, Mr. Parker Ragnanan. Perhaps, Madam CMO, just for us to be able to be clear as we begin to wrap up, let's go through what those measures are again, Prime Minister and CMO. So we talk about the work from home where it's possible, and certainly we've said that the buy-in has come in from the private sector, where they will be able to institute that as much as possible. We also spoke to that after the 9 p.m., the list of businesses that will be published. Yes. So can you give us an idea as to what those businesses, what essential services only?
Yeah, for example, the essential services, the hospitality industry, the private security, for example, the utility companies, for example, as well. And some of the supermarkets, for example, who have deliveries and there are things to be done, the manufacturing industry as well. So there are some services which need to continue after that hour. They will be facilitated. Because at this point, as much as possible, we're trying to allow services that need to happen, but for the non-essential social activities where we have groups of persons, these are the activities that we are trying to curtail at this point.
Okay. And so what can one do about perhaps an employee who is inflexible in terms of allowing them to work from home? If the individual believes that they have the capacity to work from home, and perhaps this employer is just fixed on, no, you need to be within the workplace, how can the employee and the employer have a sort of conversation that is perhaps mediated, if you will?
Well, it's really for the employers, the managers and supervisors to do an assessment of their business, to look to see, and you need to, every business is different. It would have to look at the size of the business, the number of employees that you have, and also the type of service. Mm-hmm. If you can efficiently and effectively do it with a work from home model, as much as possible, we want to ensure that the businesses are able to function as normal. We're not trying to close down any public or private sector organization, but wherever possible, and you can have your workers function at home, that is the recommendation at this point, so that we have less persons within any workspace to reduce any possibility for transmission.
Okay. And let's talk about the reduced mass crowd event. So we're moving from 50 to 25 persons.
Yes, and that as well. Mass crowds are high risk for COVID-19. Already 25 is a lot, so as much as possible, this is not the time to be planning activities at this point. But we've put a number because we recognize that there are certain family events, there are certain things that are necessary, but as much as possible, avoid the mass crowds. A special consideration was made for the churches, and we recognize that the funerals and what's associated with them, they are high risk because a lot of people from all over the communities get together, and it's difficult to physical distance during a funeral. It's a very emotional time, so we recognize that funerals pose a high risk at this point.
But there's no recommended numbers for at the graveside.
It should really be less than the 100 as well, or the 25. The 25. The 100 is for the actual church service institution. Yeah.
Okay. But at the graveside, we want 25.
And we know this has been very difficult to regulate at the graveside because people just come and they're all over. So it's another issue that we have to address in terms of the risk at those activities. Okay,
and so business operating hours, we've covered this from 9, so we're saying that the 9 p.m. is the close-off time.
Yes.
Okay. Extended closure of the school compounds, or schools have been closed, so we are keeping school closed for the next month.
Yes,
so the month of November
30 days as well.
And then we will update what the situation is depending on what happens. No consumption of alcohol on premises. So when you go into the bar, it's to order your drink and move.
Yes, buy your drink and enjoy at home.
And sporting activities. So no contact, any contact sports, high-risk sporting activities, you're discouraging that.
Yeah,
as opposed to saying no holding off.
Well, we have no holding off the high-risk contact sports. These lists will be shared as well because there are some sporting activities that are higher risk than others.
Okay, and finally, to limit our movement, depending on us as citizens to make that call for ourselves, because as you indicated, it really is each one to keep themselves safe.
Yes, absolutely.
Okay, thank you very much for that. So we went over that list. We want to give the Prime Minister an opportunity for closing remarks.
Thank you very much. These protocols are absolutely necessary to regain everyone's confidence in their safety. And what do I mean by that? We have police officers, we have nurses, we have doctors, we have security people, we have customs officers, we have people going to government on a daily basis, we have people going to the grocery stores and servicing people. We must remember that they need to have the confidence that they're not putting their lives at risk. If in fact my firemen and my emergency responders all of a sudden don't feel safe in going home, it's going to have a knock-on effect on all of us. So we owe it to each other, we owe it to our society to adhere. That's what we're at risk here. We're at risk that persons just may not start showing up, and it's going to have a significant impact. Imagine loose select workers not wanting to go to maintain the generators. Persons don't want to show up to the gas station because they're scared, because if in fact there's going to be an increased risk that there's more people who are infected, it's going to have a knock-on effect to every single sector of the society. So wearing your mask is taking responsibility, not just for yourself, but for everyone else. And I'm really appealing to everyone to understand that logic, understand the logic of your own life, understand the logic of your loved ones and everyone else. And if we adhere to these rules, and yes, I can hear some of the criticisms. Well, you just want people to go to work and go home. For the next 30 days, that's pretty much what we're asking people to do, to minimize the social behavior and activities. And I think it's a small price to have to pay to maintain structure and order and safety in our country. And we all deserve it. We're doing this not just for ourselves, but we're doing this for our community and for our country. And I want to again thank the Ministry of Health, the Minister, the CMO, and the contact tracers who've done an amazing job, the nurses and police officers and everyone that continue to come out in these very difficult times and overcome their fear, because there is fear by a lot of people. And so I just want to encourage all of us that we can succeed. COVID is not a plague. It's not the kiss of death that if you get COVID. Now, do we want everybody to avoid getting COVID? The answer is yes. So even this idea, and I know that Madam CMO didn't touch upon this, Melissa, but this is very, very important. If in fact the ministry sends you home, meaning that you've tested positive for COVID, but you have no symptoms, you can go home and be at home safely. And if you and everybody in the household practices the protocols of wearing their masks, sanitizing their hands, minimizing contact, that you won't get it. That's the reality. But it requires discipline. And this mask really becomes the difference between success and no success. And I'm sorry to say to all of us, no success is a horrible place. I'm not even making reference to it, because I know that all St. Lucians are understanding what we have to do. And I want to reassure all of the government workers. I want to reassure all of the private sector workers. I want to reassure all the mothers, all the elderly people, all the persons with underlying diseases, that we care. We care about you. And that's what this is all about. This is about caring, loving, and respecting. And we will always put you first. So let's do this for all of us. I thank you.
Thank you very much, there, Prime Minister. So we've just come to the end of our national update on the protocols being instituted for the community spread of COVID-19. As you've just heard, let me just run through it again. So there's the work from home where possible being called for. Reduce mass crowd events from 50 people to 25 people. Religious institutions as well are being confined to the numbers of the square footage. Business operating hours, so businesses will be closing from 9 p.m. However, there are certain businesses, and the list will be provided, essential services that will be continuing operation past that 9 p.m. hour. Extended closure of schools, so that will mean for the next month until November 30, schools are remaining closed, and an update will be provided thereafter. No consumption of alcohol on premises, so it's grab and go, order your drink and move on out. Restaurants are allowed to have dining at the 25 number limit. and also they're closing at 9 p.m. Sporting activities, you've just heard that high-risk sporting activities are sort of being discouraged, and contact sports as well. The list will be provided later on. And the most important one, there's no curfew being instituted. However, we are asking, the government is asking, the CMO's office is asking, the police is asking that you limit your movement between the hours of 5 a.m., 9 p.m. to 5 a.m. And of course, we've heard from the Deputy Police Commissioner, if you have good reason to be out and you are engaged by the police, you simply have to give them the reason why that you are out. And of course, the police officers will be making an assessment right there on the spot to allow you to continue on to your journey. Thank you very much to the Chief Medical Officer, Dr. Sharon Belmar-George, Prime Minister of Saint Lucia, Honorable Alan Chastanet. You want to chime in on my closing?
Because I think I don't want it to be forgotten. There is going to be some new protocols coming in place with regards to the border control, which will include the fishermen. An announcement will be made this week, and I know we're going to be meeting with the different associations, but the likelihood is by Monday that we will be suspending licenses for fishermen to go out for at least 1 week. Again, that is to regain control of our borders. And we will be looking at other measures to significantly strengthen our borders. We are bringing in new engines, we're putting in new surveillance teams, but we are going to take the breaches at the border very seriously. And we will include putting some rewards in place for whistleblowers who will help us in terms of deterring people from bringing people in illegally. We are working with our mission in Martinique to try to encourage all of those persons who want to come home that they do it legally, and so that we can keep them safe, we can keep their family members safe, and keep our community safe as well.
Thank you very much, Prime Minister. We look forward to that announcement on Monday, the suspension of licensing in the fishing sector for just 1 week as we institute new border control protocols. So thank you very much, Prime Minister, as well as to the Deputy Police Commissioner, Milton Desir. Thank you to the members of the media who participated, and thank you at home for watching. I'm Lisa Joseph. Thank you so much. Goodbye.